Hello. Welcome to the Penn Transplant Institute webinar on COVID-19, an update where we will be answering the questions posed to us by our patient community. I'm Dr. Emily Blumberg, the Director of Transplant Infectious Diseases at the Hospital of the University of Pennsylvania, and today I will be joined by my colleague, Dr. Kathleen Murphy, another transplant infectious disease specialist here at the Hospital of the University of Pennsylvania, as well as our associate hospital epidemiologist, who's been at the forefront of developing policies for COVID-19 here at Penn. We're going to be focusing on answering the questions that you've sent to us. But first, I'd like to provide you with a little bit of an update on COVID-19 in the U.S. and here in the Delaware Valley. At this point, the number of COVID-19 cases in the United States continue to increase. As of yesterday, there were 2.3 million cases of COVID-19 in the U.S., with a new caseload of 26,000 yesterday. You can see that these cases are spread throughout the United States, with hotspots now in the Southwest as well as in Texas and Florida. Fortunately, in the Delaware Valley, our incidence of COVID-19 is on the decline. And in fact, in the beginning of April, we were seeing upwards of 2,000 new cases a day. But our caseload has now dropped dramatically due to a lot of interventions on the public health standpoint, as well as your own commitment to preventing the transmission of COVID-19. So things are looking better here around Penn, and hopefully the rest of the country will catch up soon. But we're going to start with some questions, and Kathleen and I will be having a discussion about issues related to COVID that I think speak to the issues that are concerning you all now. So Kathleen, take it away.
Thanks, Emily. So a lot of the questions that we've received from patients and family members center around communities starting to reopen and how to protect ourselves in that setting. So this first question comes along that vein. When can I return to work, college, or school, and what precautions should I take besides wearing a mask? What are your thoughts on that?
This is a great question, and I think one that we're all trying to grapple with, whether or not we're a transplant recipient or live with a transplant patient. Certainly, the first thing you need to think about is what is it that you exactly do when you go to work or you're in school. So that way we can really assess where the risky spots are for you and what you can do specifically to prevent transmission in the workplace or at school. In particular, we want to know what is your connection with other people. Are you in direct connection, sharing office space? Are you able to socially distance and maintain at least a 6-foot perimeter around yourself while you're working or in school? Will you be in a place where you'll be exposed to greater numbers of people who might in fact be carrying or infected with COVID-19? All of these things need to be considered, and certainly we want to make sure that we protect your environment to the best of our ability. If you're returning to an office space where you do not have to share the space and where you're able to maintain social distancing, have access to hand sanitizer or hand wash, it certainly would be safer for you to return to work than if you're going to be working in crowded situations where you're going to be exposed to a lot of people. In addition, at this point, depending on where you live, there may be state and local regulations which actually mandate changes to your workplace or school that will need to be considered. If you have specific concerns about your workplace, we're happy to talk to you about them to try to create the safest work environment for you. And certainly, if you are able to continue to telecommute and work effectively, that's always the best option till we're past this critical stage in the pandemic. Kathleen, going along this vein, we've really been asked a lot about household contacts and the work of our household contacts, as well as some very specific occupations. So this one came from a patient who said, as a hairstylist and spouse of a transplant recipient, I'm trying to navigate returning to work in the coming weeks. Do you think my return to work will be manageable? Does returning to this particular profession pose too great a risk for our household? If so, do you have any suggestions? How can I disinfect my shoes and clothing at the end of my workday? What do you think?
So I think, again, this is a great question, and we have the balance between trying to protect ourselves and the people we live with the knowledge that returning to work in some semblance of our profession and normal life is really essential for a lot of people in moving through this pandemic from both a personal and financial perspective. So I think similar to the suggestions Emily made, the most important thing is that your place of work, if it does involve engagement with clients or people in the community, in a close setting, such as a hairstylist, that your place of work, your salon or other place of work is following state and local guidelines regarding safe reopening. So in a lot of settings, this has been limiting people in enclosed spaces, requiring universal masking, making sure that clients are asked about symptoms, screened for temperature, so that this can be done safely, in addition to doing things to protect yourself as someone working that environment, like wearing a mask, practicing good hand hygiene, extra cleaning of high-touch surfaces in the salon. But we have seen in some of the areas that have started to reopen, places like salons, safe ways of doing this, as long as these state and local guidelines are followed and there are limited people in enclosed spaces. And I think throughout this entire pandemic, we've advised that you're very careful about hand washing, things like in the home, wiping down high-touch surfaces, things you were already doing, wearing a mask at all times. And, we have been able to mitigate a lot of the risk, even in these close exposures in those settings. I think other suggestions regarding things like disinfecting clothing and shoes, what we have learned about the virus is that we think it is much less likely that the primary mode of spread or a significant risk is posed to you based on the virus living on surfaces that you touch, for example, and then touch your eyes or your mouth. Although we have seen the viral genetic material, for example, last for up to a couple of days, for example, on surfaces like glass and metal. It's much less likely to last for more than, say, a day on softer surfaces like cardboard or cloth, just because of how absorbent and dried out those can get. But again, we think the primary mode of transmission of the virus is through respiratory droplets. So being in close contact with someone who has COVID, who is breathing or talking or coughing near you, which really goes to the importance of everyone wearing a mask when they're in close contact, especially if you're in contact in a community setting like a job or a salon, where you might not have all of the information with the clients coming in about their exposures or what they're doing in the rest of their lives in the community. So some people do choose to, when they get home, wipe down their shoes with some type of sanitizing based disinfectant, whether that's alcohol or bleach, and are choosing to take off the clothing they've worn in the community and either wash that or change when they get home. And I think that is all just plays into your level of comfort, and that's fine to do. But I wanted to just at least mention here that we do think that's much less likely for the virus to be transmitted based on what would be left on clothing or shoes than it would be in the droplet mechanism, in terms of being very close to someone who's breathing or coughing or talking without a mask on.
Great, thank you. Is there new info regarding the life of the virus on surfaces? I think you really touched on this, but maybe if you could just sort of comment very briefly again to reiterate this.
Sure, and I think this came from exactly some of the similar questions to the prior submission. We again, the majority of the information that's come out is that the primary mode of transmission of the virus is through respiratory droplets. So as I said, this is really allowing us to advocate for continued universal wearing of face masks and face coverings when people are outside the home, or particularly in enclosed spaces that are indoors where there's less circulation. And I think we have limited data on the virus in terms of it being infective even from what can sometimes last for a couple days on a hard surface. But that being said, we still recommend that people are careful about hand washing and cleaning of high touch surfaces in the home or the workplace, because there is a potential for you touching a surface and then touching your face or mouth and transmitting it that way. But it's most likely not a dominant form of transmission of the virus.
Great, thank you.
So the next question, again, is also asking sort of as communities get a little bit back more into the opened up phase, how do we navigate life in this setting? So Emily, should I be going to the store or should I continue to avoid it if a family member or friend is able to do the shopping? What do you recommend?
This is a great question because I think we've all been shut in for so long that we're eager to resume our natural activities, the things we like to do, the things we do normally, and the things we need to do, get food, get groceries, get our medications, essentials in pharmacies. It's really important to realize that we're in a critical phase right now, and we're still trying to maintain some level of social distancing. So I think if you need to go to a store, you need to sort of think about what is it I need to get? How can I make my trip more efficient? And is there somebody else who can do this for me? If you have the ability to ask somebody to shop for you and you know that that's going to work out, that would be preferable because we're still in a critical phase and it would be nice to limit your exposure to other people. But let's say you don't have that option and you really need to go to the store. I think you should think about a couple of things. The first is you should organize your shopping list. You should try to limit the number of trips you're going to take, so you want to be as efficient as possible. Try to make your shopping time very efficient with a maximum number of items to be acquired at that particular trip. In other words, you don't want to be running back and forth to the store every day, but try to limit the shopping to once a week, or if you're really efficient, to even less frequently. You should shop places where you actually know the layout of the store, so you're not going to be spending a lot of time wandering around the store over and over looking for things that you are trying to find. It's best to really organize your list along the lines of where things are in the store, go in, shop efficiently, and try to maintain your distance from others while you're in the store. So if you're in a supermarket or a pharmacy, don't come right up close to other people, but wait for the aisle to clear out and then go and get the things that you need. It's really important to make sure that while you're in the store, that your facial covering is in place and that you maintain good hygiene. In other words, you should not be touching things and then touching your eyes and mouth, but you should wait. And when you're out of the store, make sure you have washed your hands thoroughly or used hand sanitizer so that you're not sort of having high touch surfaces and then your face and mouth. You want to make sure that you try to, if you have the option, order things in advance that you can pick them up, that you do that to limit your exposure around the store as well. So anything that can limit the time that you spend in the store would be beneficial, especially right now when we're just starting to reopen and we're not sure what the impact of that's going to be on the community. So short answer is, if somebody's willing to help you, take that offer now. But if not, try to be organized, efficient, maintain your social distancing and face covering and hand hygiene, and I think things will work out just fine. Kathleen, I think we all have cabin fever. And one of the common questions we're getting is, should I travel? Can I travel? What do you think?
So I can definitely appreciate this question, especially as we move into summertime and a lot of people have been avoiding seeing family and friends. Vacations have been canceled, and I think there really is a sense of when is it safe for me to travel, whether that's for vacation purposes or to see family members. And I think this is a difficult question. In general, we still recommend, because of the uncertainty and just the less control you have when you're in an environment that's not your home or your own community, about how people are practicing social distancing, how cleaning is being done, that you avoid non-essential travel and especially avoid international travel and cruises at this time, just because of, again, less control in those settings and enclosed settings. But I think for those of you who are thinking about, for example, shorter trips to see friends or family, there's things to think about. If you do decide to take short trips this summer, one thing I would think about is what's the safety of your travel mechanism? So if you're able to drive, for example, by car and avoid staying in a hotel, or by going by airline or train travel where you may be around more people in enclosed spaces who you're not aware of how they're practicing social distancing, or if they're wearing masks, for example, that would be safer just you in your own car with immediate family members than those situations. And I think if you can think just very carefully and safely about where you're traveling to. So for example, even within the United States right now, as Emily already mentioned, there are areas of outbreaks with more concerning increases in COVID-19 cases right now in the Southwest and Florida. So I think being aware within the country of where the hotspots are right now for cases is really important, because we would definitely recommend that you avoid those areas. So I think that it's an individual decision about how you can safely get to places. Is this a far trip or a close trip where you can mitigate a lot of the risk by being in your own car and staying in possibly a private residence of people who have also been practicing social distancing and being careful? All of those things that you can control to the best you're able is really important. But I think, we're still in a phase now where there's a lot of uncertainty about if our case numbers in the area will stay low. And I think we're still learning about how things will look over the next few months. So I know it's tough, but I would recommend still limiting any non-essential travel over the next few months as we see what happens in our community. And I think the other important thing is that if you do have a trip you choose to make or that you need to make, talk with your transplant team, because they can give you some more individual counseling on how to make that trip safely, because that's really important. And some people do have reasons that they need to travel, and we want to try to empower you to do that in the safest way possible.
Great, thank you. Along those lines, I think we're all starved for time to spend with our families, our loved ones, friends, children, grandchildren. What do you recommend for people in terms of socially distancing from these essential members of our lives?
So this is a great question too. And, I think it's really important to recognize that this pandemic is more of a marathon now than a sprint, and not seeing your loved ones for many, many months is very difficult. And I think we're learning now about ways that this can be done safely. So I think the most important things to do when seeing loved ones and friends is to try and have these gatherings, be small numbers of people. So, like have them with only a couple of people at a time, for example, in outdoor spaces where you can be socially distanced, where people can wear masks, and really, try to talk with your family members or friends about how they're practicing social distancing and how they're being careful in their own homes or communities, because that's the best way to make sure that people who are around you and who are visiting you are keeping you safe if they're keeping themselves safe. And I think outdoor gatherings with a limited number of people where people can be wearing masks and stay socially distanced are at least a way to see friends and family this summer in the safest way possible. And I think that's what I'd recommend for right now. But it is important to, not remain totally, I think, isolated from these important people in your lives as we move through the next few months. And I think you can do that safely.
Great, thank you.
So the next few questions, Emily, are about re-engaging in medical care in person, either in the hospital or, for example, getting procedures or tests done. So this series of questions comes from people who are wondering, is it safe to go to the hospital? Is it safe for me to get my blood work done at a lab? And is it safe for me to go to doctor's appointments? So can you speak to how here at Penn and in the local communities, healthcare facilities may be addressing this in terms of safety questions?
Thanks. This is a great question and something that we here at Penn have been working hard to make safe for you. A lot has changed, and as many of you know, your appointments were switched to telehealth appointments in many cases, and we only asked you to come back to the hospital or to the lab or to your doctor's appointments for very specific indications. And we're still working on this, but essentially, in the past month, we've put a tremendous number of safeguards in place so that we can provide really safe, individualized care that is appropriate to your own specific needs. What this means is that we've instituted extra safeguards like temperature checks and masking on entry into the building. And when that's true, whether it's the hospital or the lab or to your doctor's appointments. You'll notice that everything's a lot less crowded because what we've done is we've adhered strictly to appointment times. And so we're asking you to really follow the time that you were given for either your lab appointment or your doctor's appointment or your specific test in the hospital. We've also emptied out our waiting rooms so that we don't expect people to all be sitting together, but we've made it possible for individuals to go directly into exam rooms or directly into laboratory space because we want to make sure that you stay safe and are able to continue to socially distance. You'll notice that you'll be asked questions about symptoms before you show up for either your appointment or your lab or your test. And so it's important to answer honestly when you're given that call so that we can put the appropriate safeguards in place. In addition, for some of you who are undergoing specific testing like a biopsy or specific bronchoscopy or other invasive procedures, we are going to require that you be tested for COVID within 24 to 48 hours of your actual procedure. This is both to make the situation safer for you and for those who are taking care of you and for those who may be in the hospital for other reasons at the same time. We want to know your status so we can know how best to address your needs and keep things safe. So the answer is, we're thinking very carefully about what needs to be done in person, what needs to be done with a physical exam, what needs to be done using lab tests, and when procedures are required. And so if you're being asked to do that, please know that we thought very carefully about your own specific situation, and we have now created a situation and an environment where we think it is safe to return. We've been thinking about this very hard, and you'll notice a lot of changes, and so I want you to feel comfortable. But if you have any questions about your specific test or your specific situation, you should always feel free to contact us here at Penn Transplant, because we certainly want to make sure that you understand the safeguards in place and that you know that your health that is at our foremost concern. Along those lines, you'll notice that we didn't have visitors in the hospital for quite a while, but the visitation policy has changed. Kathleen, I wonder if you could speak to that.
Yes, so we have gotten a lot of questions about the visitation policy, and actually over the past month, our visitation policy has opened up to allow more support people to certain patients when they're in both the inpatient and outpatient setting. And it's a balance of trying to maintain safety for the patients who are being seen in the hospital and in the clinic and our staff, but also recognizing the very real benefit that and need that a lot of patients have to have someone there with them, especially as they're having important discussions in clinic, for example, or undergoing a procedure or are critically ill. And so we're trying to recognize the balance between that. And I would imagine over the next month or two, our visitation policy will open up even more, especially if our numbers in the community stay low. So right now, we on the inpatient side are allowing one support person or one visitor for patients for same-day surgery or a procedure in the ICU, and on some of our inpatient services right now on the oncology service and on our neuroscience services, as well as for women who are laboring and in the postpartum setting, and as well as parents visiting the intensive care nursery. And on the outpatient side, we are allowing a support person to come to the visit for patients who basically have a functional disability or challenges in terms of their ability to physically get into the clinic and in the healthcare setting without someone there for support, or who would benefit from having someone there to help with communication, especially if there's a serious discussion going on about plan of care, or they have a developmental disability or other reason why they may have challenges understanding or communicating back their discussion with their provider. And our transplant teams, as well as our other medical teams, have become very savvy and able to engage family members and support people who aren't able to be there with their loved one when they're in the clinic setting through teleconferencing, through FaceTime. So there's a lot of ways to engage you in the visit if you would like to be there and listen to the conversation, if you can't physically be there present in the clinic setting. And especially with the transplant team, we've recognized that a lot of the discussions before and after transplant are really important to have support people there and available and listening in. And so our priority is working to accomplish that safely as we're able to liberalize some of our visitor policies. The other thing I want to mention is that all visitors are screened for any type of symptoms that could be concerning for COVID-19 and are also receiving a temperature check on arrival to the healthcare setting, similar to patients. So that's another way of trying to make sure that you stay safe in that setting. And so that's sort of how we're navigating things now. I would imagine, as I said, that over the next month or two, we'll be able to open up visitation policy for clinic patients and in the hospital even further. But we just want to make sure that we are allowing for patients and visitors to be socially distanced and to protect our staff and other patients in the healthcare setting while avoiding a lot of crowds and some of the other situations that may pose more of a risk to everyone who's working and here for care.
That's great. I think that's very comprehensive. And I think here you've pretty much covered, all of the concerns expressed in this question too. So it's important to remember, can patients stay with their loved ones in the hospital, or family members stay with their loved ones in the hospital, or return daily? What do you recommend with respect to that?
Sure, and so this is a good question. A lot of people, especially during the actual organ transplant, have questions about what that will look like. And so just to reassure the group, patients who are, called in and undergoing transplant are allowed to have a support person there. When they arrive, they can see them right before they go to the OR, or when they're in the pre-op area, then they're directed to another place to wait during the surgery. And then once the patient gets settled in the ICU, as I mentioned, the ICU patients are allowed to have a visitor. So you will be able to have a support person here at the hospital, either in a separate waiting area or with you when you're in the ICU after the surgery. There are guidelines for the hours that visitors can be there. So even in the ICU, we're not having visitors right now stay overnight. So there's certain visitation hours during the day. And there's a couple other safeguards in place. For example, we ask that people stay in the room with the patient, and we're able to provide, for example, food in that setting for the support person so that they don't have to travel outside the room. And then we also ask that people not come and go multiple times during the day, so that they arrive during visiting hours, they stay for the amount of time that they're going to stay, and then they leave for the day. And obviously the ICU team will keep you updated, about any thing that arises when you're not there relative to your loved one's care. So we have been successfully doing this and engaging support people in the ICU, just with these couple of caveats, particularly not staying overnight, and then coming in our designated hours, and not coming and going within the same day. And it's been the most, I would say, effective if patients identify one primary support person that is the designated family member or friend who is their support person for the stay in the hospital, mainly so that we can just have similar people coming and being there throughout the duration of the stay, and they can be sort of the point person to communicate with other loved ones or other members of family or friends that the patient would like kept up to date on their stay.
Thank you. Remember that if you have questions, you should feel free to reach out to both the transplant teams as well as the nursing staff on the unit that your family member is on.
So this question gets a little bit to more of our experience now that we're several months into the pandemic about how COVID-19 affects certain patient populations. And this question was, are you finding that transplant patients with a history of lung infections or pneumonia are any more susceptible to COVID-19 than a transplant patient with a healthy lung history?
I think this is a great question, and it's actually one that I'm going to answer now. But as with many things with COVID, the answers are going to probably change over time. This has been an incredible glut of information, and because we're all sort of trying to understand things as they're happening around us, and our treatment and diagnostic capabilities have all changed dramatically in the 3 months that we've been seeing patients with COVID, I think it's important to realize that 6 months from now, we're probably going to look back and have answers for you to this question that will probably be a little bit more accurate than what I'm going to tell you today. But we have been tracking the outcomes of our patients in Penn Transplant who have COVID. And so I'd like to share with you a few things just for you to understand what we're seeing and what I think is going to reflect probably the experience nationally. One of the things to realize is transplant patients are just like other people when it comes to getting COVID-19. In other words, if they are exposed in a significant way, for example, a household contact or a significant community contact has COVID, they are just as likely to get COVID as their non-transplant family member. But one of the things to appreciate is that the manifestations, in other words, the signs and symptoms of their infection may be quite different than they are in a person without a transplant. And there's a couple of reasons for that. As with all infections, immunosuppression can either make the symptoms much less or much greater. And so we tend to find that our patients have both very mild to minimal disease to very severe disease. And the balance of patients are somewhere in the middle. We know that while patients can get sicker, it's become very important to be aware that some of the things that are making them sick are things that you should recognize and call to the attention of your care providers. In particular, the very high fevers and sometimes signs of diarrhea and nausea and vomiting have led to a greater incidence of dehydration. And this is especially important in transplant patients because dehydration can lead to very high levels of tacrolimus or cyclosporin. And so we want to know about this so we can be very careful at taking care of you. And in some cases, this does require more admission to the hospital, really for management of the dehydration symptoms. We have had some patients who've had pneumonias and some severe enough to require ICU stays, but this has been a true minority of the patients that we're seeing who are transplant patients with COVID. And it doesn't seem that the lung transplant patients are getting more COVID infections, although they may in fact have a little bit more pneumonia than patients who've not had lung infections. This isn't necessarily surprising, as lung transplant patients tend to have more pneumonias than other transplant patients. So the bottom line is that if you think you have COVID, you should call us immediately because we can both arrange for your testing as well as make sure that the proper safeguards are in place to see if you need to come to the hospital for further treatment or can be managed at home. And we have a lot of services in place to actually help manage people at home if we think that can be done safely. If you feel short of breath, are having a change in your ability to stay awake or to think clearly, or manage your fluid intake, or have very high fevers, you should consider promptly coming to the hospital for further evaluation. In some cases, It may even be safest for you to go to the closest possible hospital, especially if you are having shortness of breath or if you find that you are not of clear mind. So we're interested in making sure that we take care of you. If you have any questions and think you have COVID, please call us immediately so we can attend to your needs as promptly as possible. But I think in the next few months we'll find that the course of the illness in transplant patients is probably going to be as diverse as it is in the general population. Kathleen, we've spent a lot of time thinking about COVID testing for donors and recipients here at Penn. I wonder if you could share where we are now.
Thanks, Emily. So this is another good question. And, we have put a lot of thought in both here at Penn and actually nationally and internationally about how to make sure organ donation is as safe as possible in the era of the pandemic. And so a lot of this has been around testing of donors and recipients actually to try and make sure we are mitigating as much risk as possible in this setting. So we do test all donors for COVID-19. This is based on a viral genetic test. That's a nasopharyngeal swab that we've been performing. And this is, again, a genetic test looking for any virus. So this is done for both deceased donors as well as living donors. They're actually tested twice, and this is in very close proximity to the time of organ donation. And we also test all recipients, also in very close proximity to the time that they are going to the operating room to receive the organ. So in this way, we've been trying to make sure that we understand whether there's any concern for COVID infection in the donors or the recipients, and that we can do this as safe as possible.
Thank you.
And then our final question, Emily, is this all a hoax? Can we believe the media and the government?
Yeah, I think we wish this were all a bad dream and we were going to wake up and realize none of it had happened. But I can tell you from working in the city of Philadelphia, this is no hoax. Sometimes we can believe the media and sometimes the media says things that's not quite right. But I think we have to acknowledge that we are living in unusual times at the height of a pandemic with a virus that we're still learning a lot about as we go. I think the most reliable sources for all of you are the CDC website and the resources we have on our website, as well as resources from some of the major transplant organizations like the American Society of Transplantation and some of the other medical societies that have patient and community websites for information. You should be taking this seriously. I think we're going to get through it, but it's important to realize this is by no means a hoax. We are living this reality. We need to take care. So I'd like to leave you with a few just sort of words of wisdom that are from the CDC. And for those of you who haven't been on the CDC website, it's worth a look because they have a lot of practical advice in easy to understand language that will help you live more safely and get us all through what have been some very tough times. So let's just review some of their key guidance. The first is to know how this virus has been spread. And I think Kathleen spoke clearly about this. The major way that this has been spread is by close contact with people who are shedding this, typically from respiratory droplets. So for that reason, it's important to understand this, stay away from sick people, and to really make sure that you're taking precautions. What are those precautions? Well, you should all be practicing really good hand hygiene. You should be washing your hands frequently, either with soap and water for 20 seconds or with a waterless hand hygiene solution, and there are a number of them on the market. They should have at least 70% alcohol in their base. It is important to do this frequently, and certainly to do it before you're eating and before you touch your face, especially your mouth and eyes. So please be careful and wash your hands frequently. We still think it's important to avoid crowded situations and to the best of your ability to maintain social distancing. In other words, stay 6 feet away from people. This is actually something that should help prevent the spread of the infection by those droplets that Kathleen was talking about. We still strongly urge you to use facial covering. Cloth masks are fine, and there's some advice on the CDC website about how to construct one if you haven't done so yet. We also recommend that if you have access to surgical masks, you could use that instead. But really, we want you covering your face when you're out in public, especially if you're going to be in contact with other people. If you're coughing or sneezing, we want you to cover your cough or sneeze. You could certainly do that with a tissue, but you could also do it with your elbow or with your sleeve. Do not cover your cough or sneeze with your hands because that will contaminate your hands, and certainly if you do that inadvertently, you should immediately wash your hands. We want you to remember to frequently clean and disinfect those commonly touched surfaces, so that will prevent the spread of the virus on those high-touch surfaces. So remember what Kathleen said, the virus particles can remain on surfaces for over a day if the surface is non-porous, in other words, a hard surface like glass or metal. If it's on a surface that's like a cloth surface, the survival is going to be much less because the virus is going to dry out more quickly. But in order to prevent contamination, if you simply clean these surfaces frequently, that will help. And using any of those disinfecting wipes is an easy way to do that. Finally, we want you to be attentive to your symptoms, your sense of well-being, and those of your household contact. And if you sense that something is off, you're not feeling right, you should always feel free to call us. Remember, here at Penn Transplant Institute, we are here for you. These are scary times, and we appreciate that you all feel worried and under pressure. Please don't hesitate to reach out to those of us who are taking care of you at Penn Transplant if you have any questions whatsoever. There is no question that is too trivial. There are no stupid questions. We understand everybody's situation is different, and while we've given you some guidance today on where things stand here in the end of June 2020, that your own situation may not have been covered, and you may have some specific concerns. Never hesitate to reach out to us. We are here for you. Thank you very much, and we look forward to answering more of your questions in the not-too-distant future. Thank you, Kathleen, for joining me today to participate in this webinar.